Dani Carvajal of Real Madrid suffered a very significant leg injury that actually required him to be carted off of the field. Sources have officially come out and said that Carvajal is officially dealing with a tear to his anterior cruciate ligament, his lateral collateral ligament, as well as injury to his popliteal tendon, unfortunately going to sideline him for the remainder of the season. The mechanism of injury in this case is he went and did a kick, and doing so he made contact with somebody, forcing his knee into severe hyperextension. Unfortunately, this is a very risky position for the knee and can lead to a multi-structured knee injury. Therefore, with today's video, we're going to go over the relevant anatomy of the knee. We're going to talk about why that hyperextension position of the knee is so risky for these structures, and we'll talk about what he should expect moving forward in terms of surgical intervention and what to expect in rehab. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they are a little bit easier to understand. I'll also talk about what that person should expect when moving forward, whether the injury requires surgical intervention, rehab, and a timeline for their return. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to this channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have suffered a multi-structure knee injury, go ahead and comment on your experience in the comment section below. We can see here in the injury replay that as Carvajal goes to make the kick, he's going to make contact with the defender, and this is going to place his leg once again in a severe knee hyperextension. So here I have a model of the knee joint, and so the top portion of the knee is formed by this femur, also known as the thigh bone, which is going to come on down and form the top portion of the knee. Then the bottom portion of the knee is going to be formed by this other long bone known as the tibia, also called the shin bone. And on the side here, we also have another long bone known as the fibula. Now let's go ahead and talk about the motions at the knee joint. So the knee joint has two motions. The first one is known as flexion, where we're going to be bending the knee like so. The opposite of that is going to be knee extension, where we're going to be straightening the knee. Anytime we're talking about hyperextension, this means that the person is going beyond their normal value of extension at the knee. Usually people have a little bit of hyperextension naturally. The textbook value for full extension is going to be 0 degrees, making this a straight line. However, once again, most people do in the clinical setting, we find that they do have a little bit of hyperextension. However, when a person goes into forced hyperextension, this is way beyond their normal value and is extremely risky for multiple structures that are located in the knee that I'm going to go over right now. The knee joint has 4 major ligaments that contribute to overall knee stability. The first one, located right in through here, is the anterior cruciate ligament, also known as the ACL for short. Then as we flip the model towards the medial or inside portion in here, we have the medial collateral ligament. As we flip towards the outside, we have the lateral collateral ligament, also known as the LCL. And finally, on the back portion of the knee here, we have the posterior cruciate ligament, also known as the PCL. Located inside the knee, we have the medial and lateral meniscus. These are 2 pieces of fiber cartilage that essentially are preventing friction between the femur and tibia bones. Now let's talk about why forced hyperextension is so risky for multiple structures located in the knee. As I take this model and I force it into hyperextension, you can see that as I'm doing this, it is stressing all of those major ligaments of the knee, including the LCL, the MCL, the ACL, and the PCL. Oftentimes when a person goes into forced hyperextension, it's more on the rare side to have an isolated ligament injury. Usually it is accompanied by multiple structures. The most common ligaments that are involved in a knee hyperextension usually are the ACL and the MCL. However, in this case, we know that there is damage to the ACL, the LCL, and something else known as the popliteal tendon, which is located on the back portion of the knee. The popliteus muscle is going to attach from the tibia here, crossing the knee joint to the lateral portion of the femur. And when we talk about a ligament, first of all, a ligament attaches a bone to a bone. A tendon, on the other hand, is going to attach a muscle to a bone. So when we're talking about the popliteal tendon, we're talking about a continuation of that popliteus muscle where it's going to attach onto the bone. An isolated tear of the popliteal tendon is extremely rare. Therefore, usually when somebody is dealing with a popliteal tendon rupture or any sort of damage to the popliteal tendon, this is accompanied by other knee injuries. In this case, unfortunately, that is the case. The gold standard to diagnose these injuries, of course, is going to be the MRI. However, there are some on the field or in the clinic tests we can do if we suspect somebody has suffered a ligament injury. The first one to essentially rule in an ACL injury is one known as the Lockman's test. And so with this test, we're going to be stabilizing the person's thigh. We're going to be pulling on that person's tibia, because the ACL's main function is to prevent any sort of anterior translation or anterior movement of that tibia away from the femur. So we're going to perform this test on the injured side, and then we're going to do it on the non-injured side. And if we feel like the person has laxity, then this makes us think that they're dealing with an ACL injury. Now let's talk about the test for an LCL injury. This is known as a varus test, and varus essentially means that we're getting a medial to lateral force. So when we do this varus test, we're going to be stabilizing the person's knee, and we're going to be pushing force through the medial compartment, going through the lateral compartment. You can see as I do this, it wants to gap that lateral portion of the knee, and it's stressing the LCL. Once again, we do this and we compare it to the non-injured side. And if we feel that the injured side is experiencing laxity, then this also makes us believe that a person has suffered an LCL injury. There is, of course, a grading system for these ligament injuries. There are grades 1, 2, and 3. In a grade 1 ligament injury, this is where we're getting maybe some micro tearing, but usually just overstretching of the affected ligament. In a grade 2, we consider this a partial tear, and it can be accompanied by instability at the joint. And finally, in a grade 3, this is a full rupture. In this case, we know that Carvajal, unfortunately, is dealing with ACL and LCL tears. Usually, if they're reporting this, it's more along the lines of a grade 3. Sources have also said that he's expected to have surgery, and usually in this case, they're going to be doing full ligament reconstructions, whether it be for the ACL, the LCL, and or both. Usually, they're going to get that ACL reconstruction, and sometimes the LCL can be repaired depending on the severity. In ACL reconstruction, essentially what they're doing here is they're taking a graft, whether it be from the person or a donor, and in this case, what they're going to do is they're going to rebuild that ACL. If the LCL is torn severely enough, they're going to do the same thing there. However, in this case, the one that's really going to hold them back in terms of a timeline is going to be that ACL reconstruction, because it takes significant time for that graft to heal. It also is a very extensive rehab process. Multi-ligament injuries of the knee requiring surgery, unfortunately, are going to take anywhere upwards of about 9 to 12 months. It really depends on the severity of the injury and what else is accompanied with this injury. We know that he is dealing with a popliteal tear as well. So that is going to influence the recovery process. So if I happen to hear any updates regarding his follow-up appointments, or if they post anything regarding his rehab process, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update me as well. So we wish Dani Carvajal the best of luck moving forward with his injury process. Unfortunately, once again, this is a very extensive rehab, and it is unfortunately going to end the remainder of his season. Thank you so much again for tuning in today. If you enjoy this sort of content, I'm going to go ahead and link one of my playlists so that you can watch some of the videos that I've talked about injuries of in the past. Thank you so much again for tuning in, and I'll see you next time.